Now let's talk about changing the trach. First thing that you're going to do is you're going to gather your supplies. You're going to need your 2 trachs, your same size and one size smaller. You always bring the smaller one close, just in the event you're unable to get the same size in. You want to secure the airway with the smaller one. You are going to need some water. I have some drawn up here, so when we refill our cuff, it's only going to be with regular water, no normal saline. And my extra to deflate my cuff prior to taking out, my roll, my water-soluble lubricant, my ambu bag and mask. And then when you're doing a trach change, you're gonna kind of make a little bit of a mess with the water-soluble lubricant. So it's best to go ahead and gather your trach care supplies and do that when you're finished changing the trach. So before you change the trach, you're gonna go ahead and make sure that your new trach is patent. So we're gonna open this. It is a sterile package, but a clean process. So I'm gonna, as you can see, my obturator, you have your 2 parts of your trach, your regular trach with your flange or your wings, your hub and your length. Your obturator is your only purpose for the obturator is for insertion. So it's a guide wire, and it makes the trach a little bit stiffer for insertion, and then will be removed immediately after. I'm gonna place it here. I'm gonna take my water, and I'm gonna check my cuff on the one that I'm gonna insert. So I'm gonna place water, watch my cuff go up. I'm gonna disconnect so that I make sure that it doesn't backflow on me. Now I'm gonna remove it, and I'm make sure, I like to go back twice. I pulled back on it once. I'm gonna do it again just to make sure that there's no remaining water or air. Okay. Now I'm gonna lubricate my trach. You may open the package, squeeze it in here and dip it, or you may stick it into the package. Either way, you just need to lubricate the tip of the trach. You don't have to worry about getting it all the way down, just on the tip, okay? I'm gonna put this to the side with me. I'm gonna place the roll under my patient's neck. Okay, and before I remove anything, I'm going to go ahead and make sure that my cuff on my patient's current trach is deflated all the way. And again, I'd like to do it twice just to make sure. Okay. You're going to suction your patient before you change the trach. That way you can remove secretions, and it allows you to get them out of the way because it does kind of stir secretions. I'm going to go ahead and remove my old gauze. Put it to the side. Okay. I have my new trach nice and close to me. Okay. I'm going to take down my collar, and I like to leave it in place just in case in the event I need to attach it quickly or between changing the trach and doing trach care. So I'm right-handed, so when I remove the trach, I'm going to take it out with my left hand or my right hand. You could do it either way, of course. When I come out, I'm going to come out and down towards their toes. Out and down towards their toes. If you come straight up, you're going to flatten this trach and you might hit a wall and you're not going to be able to get it out. So it's important that you come down to the toes. For the new trach, I'm going to place my thumb on the obturator and my fingers on the wings. It allows me to keep my obturator in place because if it slips back, it's not doing its job, right? So when I insert, I'm going to again I'm thinking about going towards my toes. I'm going to use this as a north, south, east, west. And when I insert, I'm going to go into the stoma and then down towards the toes. When I get it in, I'm going to place my hands on to secure and immediately pull out my obturator. Now, if there is water in the patient's cuff, you would go ahead and secure your collar and then place the water back in there. The difference between the cuffed tubes is that the clear one is water only, never want to use anything like normal saline. The blue ones are air. Just think of the air in the sky as blue, so that's how you can remember to differentiate between the two. All right, so we have it secure, and then we would proceed with cleaning the trach. Again, if you have water, you're gonna put it in. So the Bavonas are the ones that have the clear cuffs. So those ones are a very common one that we use here at TCH. An important thing to also remember about your Vivona is that if your child has an MRI, it's going to need to be changed temporarily because there's a metal coil in it.